नहीं रहता उन 50 में आधे लोगों का इलाज नहीं किया जाता है, और जिनका इलाज किया जाता है उनका आधे लोगों का कंट्रोल भी नहीं होता है। तो मतलब मान के चलिए कि 8%, 10% लोगों को ही कंट्रोल में करा जाता है। तो इसके लिए हम बहुत सालों से इस विषय में काम कर रहे हैं, और अभी तक हमारा फोकस रहा था कि कैसे थोड़ा सा ह्यूमन रिसोर्स को चेंज करके, ताकि हर चीज डॉक्टर से ना करा के नॉन फिजिशियन हेल्थ केयर प्रोवाइडर, नर्स हुए, ऑक्सिलरी नर्स, मिडवाइफ हुए, जहां डायटिशियन होते हैं वहां उनसे शुरुआती कार्रवाई करा के, ताकि डॉक्टर से खाली वही काम कराया जाए जो केवल डॉक्टर कर सकता है, बाकी काम दूसरा कर ले। थोड़ा इस प्रिंसिपल को टीम बेस्ड अप्रोच कहते हैं या टास्क शेयरिंग करते हैं। और एक दूसरी चीज जो हमने करी थी वो ये थी कि सरकार ने नेशनल प्रोग्राम के जरिए एक पोर्टल, एक वेबसाइट बनाया हुआ है, उसमें अगर हम प्रयोग करें ताकि वो डेटा हर समय रहे, क्योंकि जब हम डॉक्टर के पास जाते हैं तो हमारे पुरानी इंफॉर्मेशन भी डॉक्टर के पास होनी चाहिए। और उसी के अंदर हमने एक सॉफ्टवेयर एल्गोरिथम डाले थे जो हम कहते हैं क्लिनिकल डिसीजन सपोर्ट सॉफ्टवेयर, और इस सॉफ्टवेयर के जरिए मैनेजमेंट के प्रॉम्प्ट मिलते हैं डॉक्टर को, उनको सहायता मिलती है क्या दवाई लेनी है, क्या इलाज करना है, उसका निर्णय करने में। तो हमने शुरू में ये काम किया, लेकिन अब जो ये प्रोजेक्ट हम शुरू कर रहे हैं वो इंडियन काउंसिल ऑफ मेडिकल रिसर्च उनका एक ये इनिशिएटिव है। इसे हम नेशनल हेल्थ रिसर्च प्रायोरिटी प्रोजेक्ट कहते हैं। इसमें 14-15 ऐसे प्रोजेक्ट हैं। ये प्रोजेक्ट गैर संक्रामक रोगों के लिए इनका एक इम्पोर्टेंट प्रोजेक्ट है, जिसमें जो नॉन हॉस्पिटलाइज पेशेंट, जैसे ओपीडी के जरिए जो क्लिनिक में दिखाने जाते हैं, उनकी हम कैसे इलाज, उसको कैसे बेहतर किया जाए पब्लिक हेल्थ केयर इंस्टीट्यूशंस में। तो उसके लिए हमने, और ये जैसे बताया साहब ने अभी कि चार जिलों में ये कार्रवाई करी जा रही है, एक त्रिपुरा में, एक आंध्र में, एक महाराष्ट्र में और एक हरियाणा में। और एक कॉमन स्ट्रैटेजी इवॉल्व करी जा रही है, जो एनसीडी का जो गवर्नेंस मॉडल है पब्लिक इंस्टीट्यूशन में, उसको कैसे हम स्ट्रेंथन कर सकते हैं, जो ह्यूमन रिसोर्स डिप्लॉयमेंट है उसमें हम कैसे इंप्रूवमेंट कर सकते हैं, ड्रग सप्लाई और प्रोक्योरमेंट और सप्लाई चेन में कैसे विस्तार ला सकते हैं, जो हमने पहले बताया था इलेक्ट्रॉनिक क्लिनिकल डिसीजन सपोर्ट, उसको कैसे इंटीग्रेट करा जा सकता है, डॉक्टरों की और जो नॉन फिजिशियन हेल्थ केयर प्रोवाइडर उनकी ट्रेनिंग में कैसे किया जा सकता है, रेफरल में कैसे इंप्रूवमेंट किया जा सकता है। अभी तक ये काफी हद तक जो डॉक्टर है वो अपने डिस्क्रिप्शन पे रेफरल कर देता है। हम चाहते हैं, और ये हमने थोड़ा शुरुआती काम दूसरे प्रांतों में किया हुआ है, कि कैसे एक ऑब्जेक्टिव तरीके से निर्णय लिया जाए कि किस मरीज को रेफर करके उस तरीके इलाज की आवश्यकता है उसको वहां भेजा जाए और वहां तक पहुंचाने में उसकी सहायता करी जाए। क्योंकि ये बहुत जरूरी है कि वो मरीज जिसको जैसे डिस्ट्रिक्ट अस्पताल या मेडिकल कॉलेज की केयर की आवश्यकता है वो वहां पे जाएं, और जिनका काम प्राथमिक लेवल पे किया जा सकता है उनका इलाज वहीं पे कर दिया जाए और एक सपोर्टिव मैकेनिज्म बनाया जाए। तो इसीलिए ये हमने थोड़ी सी पहले शुरुआती काम कर लिया, लेकिन कल हम इसलिए आए थे कि एक टेक्निकल सपोर्ट यूनिट का क्रिएशन किया गया है जो हेल्थ सेक्रेटरी के अधीन रहेगी, और वो उनसे हम लगातार वार्तालाप करके उनके साथ हम जो भी हमारी सीख होगी उनको हम बताएंगे, उनसे फीडबैक लेके एक मॉडल ऑफ केयर डेवलप करेंगे। 6 महीने के लिए उस मॉडल ऑफ केयर को हम एक ब्लॉक में या 2 ब्लॉक्स में इंप्लीमेंट करके देखेंगे कि वो उचित है कि नहीं है, कुछ और परिवर्तन लाने की आवश्यकता है कि नहीं है, और उसी प्रकार उसको इवॉल्व करके लोकल स्टेक होल्डर्स, चाहे वो सर्विस प्रोवाइडर्स हो चाहे वो बेनिफिशियरीज हो, उनका फीडबैक लेके एक मॉडल स्थापित करेंगे नॉन कम्युनिकेबल डिजीज की केयर के लिए, और फिर उसको पूरे जिले में इंप्लीमेंट करके देखेंगे उससे क्या लाभ हुआ है। हमें उम्मीद है कि जो फिनिश प्रोडक्ट होगा उससे हम एक एनसीडी केयर में बढ़ोतरी ला सकते हैं, और वो जो मॉडल बनेगा वो ना केवल एक जिले में रहे, पूरे प्रांत में जाए, और 4 जगह जहां काम हो रहा है उनसे जो हम सीख ले सकते हैं उससे ना केवल इन प्रांतों में लिमिटेड रहे पर वो पूरे देश में व्यापक रूप से उसका इम्प्लीमेंटेशन हो जाए। तो विचार यही है कि जो रोग इस समय 2/3 मृत्युओं का कारण है, नॉन कम्युनिकेबल डिजीज से 2/3 जो अगर 100 लोग मर रहे हैं तो उनमें से 2/3 लोगों की डेथ इन रोगों से हो रही है, उस पे इम्पैक्ट लाके देश की स्वास्थ्य जो स्थिति है उसमें सुधार लेकर हम आए।
क्वेश्चंस থাকলে প্রশ্ন থাকলে করতে পারেন।
remarks while they're waiting. Some remarks over there.
मैम आप कुछ बोलेंगे?
क्वेश्चन आंसर कीजिए।
हाँ।
Question is that is there any portal to track the achievement and progress or that data that the media can access or people can access?
So that's a very important question. There is something called the National Program for Non-Communicable Disease portal, right? Now, that portal gives you information of number of people who have been screened, number of people from those who have been then referred for confirmation of the diagnosis, and then number of people on whom treatment has been started. That portal was modified last year in May, and now it is getting slowly operational in different parts of the country. But that will be the primary source by which public, as general, the media, will be able to get that information in a particular district. So it will be down not to a district level and even to a sub-district level. That information will become available from that. That depends on how much that portal is being at the moment implemented in different parts. As I said, this was modified last year, so the process is still ongoing, but the idea is to give information with full transparency to all concerned.
And who will be in charge in the stage to communicate so that people or media can get that?
So you actually don't really even need to communicate because you can access that portal for yourself. And if there's a follow-up question, obviously the state health department would be the appropriate people to respond. The idea is to make it like you would normally look for any information. That information should become available to you.
Repeat the name of the portal.
So the program, this is a national program for non-communicable diseases. It's called NP-NCD, and the portal. So if you just type portal for NP-NCD, you should be able to reach that. So we have previously actually worked in Tripura. We worked in Tripura previously. We have some prior experience of working here, and therefore, I think the first question you should have asked, why did we decide on Tripura? Because, we first decided to work here because of our prior experience and the fact that we, found a very enthusiastic and willing health administration. And Gomati was, I think, with mutual discussion, it was decided that it gives, please remember that we are stationed in Delhi. So we also have to look at some logistic convenience also. So we needed to we would come to Agartala and we would want to be in a district which is in the vicinity. It just gives us easier access. But there is a field staff which is located here. We have 10 members of our research team who are physically located here and they are working out of home.
I'm suggesting that you ask questions which are important to the public. I mean, you can answer some diet, physical activity, smoking. So those kind of questions if you have, we'll be very happy to answer. No, I was saying that you can ask questions related to what is of interest to the general public. I mean, apart from the project itself, like about the diet, about physical activity, about smoking, about how to take the treatment, any general question that you may have.
Do you have any statistics? How many patients there in Tripura?
So, off the top of my head, I will be able to give you some broad answers, not from this portal, but there have been surveys which have been conducted. So, the ICMR conducted something called the INDIAB survey, which was a pan-India survey across. So, this was done in different phases. Tripura was done about 7 or 8 years ago, if I'm not wrong. And just to give you a little sense, I don't remember the blood pressure numbers off the top of my head,
30%.
but 20?
30%.
For about 10%, approximately 10% of people had diabetes, adults, right? Another 15% had pre-diabetes, which are people who may progress to develop diabetes. And usually the ratio between diabetes and high blood pressure is about 1:3, so about 30% people had high blood pressure. And obesity was in, again, about 16%. And, a larger waist circumference was in about between 1/4 and 30%. So amongst the seven sister states, Tripura had the highest level of diabetes, and that's why it's important to use this as a position place to develop a model which then can be applicable to not only Tripura but the region itself.
Sir, as you said, Tripura has the highest diabetes in the Northeast.
In that survey. So quoting a specific survey, which was an ICMR-led survey, that is, so Sikkim actually had higher, but I was talking of the seven sisters. In that, Tripura had the highest.
Excluding Sikkim.
Excluding
Sikkim also a hilly state, also state. What are those states? What happened?
So why is a very important question, and if we had the full answer, we would have sort of given solutions also. I'll answer in part, then I'll ask my colleague to also fill in. So there has to be some sort of predisposition, but more important and above that is, what our lifestyle and other environmental factors are. Now, without going to specific details, because I don't think that has been looked at, as Dr. Prabhakar has mentioned, so I'm going to pass it on to him. Obesity, the type of diet, the level of physical activity, exposure to tobacco and tobacco products, all of this will contribute, which may vary from place to place. So urbanization has a negative impact because urbanization and mechanization has a negative impact because a lot of people who would have otherwise done physical activity for their work or cycling to work or walking to work will use, public transport. I'm not saying we should not have public transport. I'm just giving you an example. Tobacco and smoking is an absolute strict no-no. I mean, that's a non-negotiable thing. It's not that you can take something once in a while. That's not negotiable. The diet is that we are traditionally very carbohydrate rich in our diet, right? And so that contributes. So maybe I'll ask Dr. Walker to take it from here.
Diet is one of the most important risk factors. So carbohydrate consumption is almost 80 to 85%. The recommended carbohydrate consumption should be around 60%. A major source of carbohydrate is our rice eating. So one of the suggestions which we make is, suppose you have 3 katoris of rice for your lunch, replace that 1 katori of that rice with a vegetable or some cut food or something like that. The second problem is in the tribal populations. I don't know whether it is, we don't have specific data on Tripura, but most tribal populations in the country consume a lot of salt. So salt reduction because salt is an important risk factor for hypertension. So we need to reduce the salt. The third is alcohol consumption. Alcohol is an important risk factor for hypertension, for obesity, and even stroke. So one needs to earlier people used to say it protects the heart if you take a little bit, but that's no longer true. It's neither protective nor neutral. It's neutral. So if you don't drink, don't start. If you are drinking, don't try and avoid as much as possible. And occasionally you are a social drinker, don't have more than 2 drinks. So this is a simple rule that one needs to follow. The second thing is the way we drink also is a problem because we drink before our meals. So along with that goes all the bad food, your snacks and other things. So you have to be very careful about that. The third area in diet is low consumption of fruits and vegetables. So whenever we talk of fruits and vegetables, people say, "Arey bhai, ye to bahut mehenga hai, hum apple nahi kha sakte hain." That's not required. Eat the locally available, whatever fruits and vegetables is grown in Tripura, you eat that. And the WHO recommends 5 servings. Then in terms of physical activity, the simple thing is, apart from whatever you do, if you are not obese, you want to maintain your weight, if you are able to do half an hour of brisk walk, right? Half an hour brisk walk, 5 days a week, that would be sufficient. But if you're obese, you might have to do 45 minutes to 1 hour, you might have to do it daily. And along with this brisk walk, if you're able to improve your muscle tone by some stretching exercises, maybe 10 minutes a week, that should be sufficient. Then tobacco is a complete no-no. That's a thing. Then obviously for younger generation, there's some consumption of other recreational drugs that has to be completely, there has to be regulation. We need to somehow completely prevent it. So if we manage these things, actually nearly 50-60% of the problem can be prevented. Like for example, it has been calculated, if you lose 1 kg weight, your blood pressure comes down by 2 millimeters of mercury. 2 millimeters of mercury, if you lose 1 kg. If you lose 10 kgs, you are losing 20 millimeters of mercury. And at a population level, if you reduce the blood pressure by 2 to 3 millimeters, it makes a big change. Then the last area, I think, is the emerging area of air pollution. I don't know what the air pollution level is price, but it's likely to be higher than the recommended. Yeah, higher than recommended. So we need to take steps to prevent that.
But we have to change our lifestyle.
Changing the lifestyle is very, very important. Simple measures, salt avoidance. People say, "Kaise kar sakte hai salt avoidance?" So I tell them, as a physician, I would tell them that salts which are very rich in sodium, like our pickles, the snacks that we consume, then avoiding using salt in our salads. Salads में salt डाल देते. Then the feeling that arises, खाना बनाया, salt कम है तो we'll add salt. We'll add salt to yogurt. These things if we avoid, I think we can majorly reduce our salt.
As you said, that consume fruits and vegetables. Okay. But in case of diabetes patient, doctors often suggest that you should eat pineapple like this,
Right.
jackfruit, which are very commonly available in Tripura. So what will
I'll give general comments and then I'll hand over to Professor Nikhil. The general comment is that every fruit is alright. There are some fruits which have a high sugar content. One example you rightly pointed out is pineapple, banana. But if instead of having one whole banana, if you can have half a banana and also match it with physical activity, that should be fine. But there are certain fruits which should be avoided by people with diabetes. Certain fruits are very good. Orange, for example, instead of taking it as a juice, a lot of people take juice. That is bad. Take it as a whole fruit, right? Apple is all right, orange is all right, but banana and pineapple, jackfruit, they have to be reduced. You can answer that.
So actually, I think the important, as a concept, I think what Dr. Vakar is saying is important to understand. So let's start with apple, right? You can have the full apple with the peel, right? You can take the peel off and have it, and you can take juice out of it. Nothing has changed in the apple except what you've done is you've actually removed the fiber. So the highest rise in sugar will happen if you drink the juice, less high if you eat the peeled apple, the least high will be if you have the full apple with the chilka. So with the peel. So simple things like that, if you just keep in mind, calories are the same, sugar content is the same, you've not changed anything, but आपने फाइबर चेंज कर दिया. तो उसी तरह जो छिलके वाली चीज है, जिसका छिलका खा सकते हैं, वो छिलका खाइए उसको, राइट? आपने जैसे दाल खाया, दाल में आप रसम के साथ भी खा सकते हैं, दाल में आप सांबर जिसके अंदर सब्जी वो भी खा सकते हैं, दाल में सांबर और साथ में जो सैलेड वाली चीज है वो भी मिला के खा सकते हैं. वही चावल का जो राइस आएगा शुगर में, वो तीनों परिस्थिति में अलग होगा. So these are just sort of simple. So you're not doing anything. You're eating what you're eating, right? कुछ नहीं बदला. कैसे खाया वो बदल लिया. Alcohol, I think, I know I'm going to become very unpopular with this statement, but so जैसे 1 gram of carbohydrate में 4 कैलोरी होता है, 1 gram of fat में 9 कैलोरी होता है, 1 gram of alcohol में 7 कैलोरी होता है. So let us say somebody has a large whiskey, right? 60 ml. 40% उसके अंदर अल्कोहल है, मतलब 24 ग्राम अल्कोहल हो गया. आप 7 से मल्टीप्लाई कर दो, आपने ना 250 कैलोरी ले ली है और आपको पता नहीं लगा कि आपने 250 कैलोरी ले ली है. एंड एज डॉक्टर प्रभाकर सिंह, कई बारी पीपल डोंट ड्रिंक डेली. कई बारी होता है मतलब वीकेंड में ड्रिंक कर लिया, बट वीकेंड में ड्रिंक किया तो मतलब एक ड्रिंक पे नहीं रुके, एक से ज्यादा, और उस दिन इसका मतलब आपने 300, 400, 500 कैलोरी जिससे ऐसे ही एक्स्ट्रा चली गई और आपको ख्याल ही नहीं आया, क्योंकि आप तो मतलब पानी के रूप में पी रहे थे.
तो एक कॉन्सेप्ट डॉक्टर साहब ने अभी बताया, इट्स कॉल्ड ग्लाइसेमिक इंडेक्स. वो बहुत जरूरी है. ग्लाइसेमिक इंडेक्स क्या होता है? अगर हम एक ग्लूकॉन डी है, लोग कंज्यूम करते हैं ग्लूकॉन डी, बस इट्स डायरेक्ट या तो शुगर अगर आप लेंगे वो पूरा ऑब्जॉर्ब हो जाता है, उसका ग्लाइसेमिक इंडेक्स माना जाता है 100. सो द क्लोजर टू 100 इट इज, इट्स कॉल्ड हाई ग्लाइसेमिक इंडेक्स. 80, 70 के ऊपर. So we have to reduce the glycemic index to 50, 40, 50 or 60. तो हम white rice खाते हैं, white rice का glycemic index 60 to 70 होता है. उसको कैसे कम करें? उसके साथ चना डाल दीजिए, जितना आप राइस लेते हैं उसके साथ चना डाल दीजिए, उसका ग्लाइसेमिक इंडेक्स ऑटोमेटिकली कम हो जाएगा. तो बहुत ही सिंपल तरीका है. हम ये नहीं कह रहे हैं कि हमारे प्रोफेसर डॉक्टर रेड्डी होते थे, वो कहते थे मॉडरेशन बट नॉट मार्टिडम शुड बी योर गोल. यू डोंट हैव टू बिकम अ मार्टिर. सारा छोड़ दिया, ये कर दिया, वो नहीं. मॉडरेट तरीके से थोड़ा थोड़ा कम करके ले लीजिए, एवरी यू विल बी ऑल राइट. So you have to take practical steps. You can define what you want to do, but do it in a practical way. Get a brown rice is better, but brown rice not many people like it. It's not easy. So white rice, you make it like brown rice by adding the chana to it, by adding more salads to it. So that's how you do it.
So कहने का बेसिकली मतलब ये आपको ना जाके नई चीजें खरीदने की जरूरत नहीं है. नहीं तो होता कि अब हम जाएंगे, किसी का एक्सरसाइज करना है तो वो जबरदस्ती जाके ना महंगे जूते खरीदने जाता है. क्यों? कोई जरूरत नहीं है. क्या मैं जिम का मेंबरशिप करने जा रहा हूँ, बाहर है ना घूमने की जगह, तो ना वो एक्सक्यूज बन जाता है कि हम नए जूते नहीं खरीद पाए, हम जिम नहीं जा पाए, पर वो जरूरत ही नहीं है ना. तो जो है उसी के साथ जो किया जा सकता है वही देखना चाहिए, और उससे अधिकतर चीजें संभव हो जाती है. तो ये समझना चाहिए. ऑब्वियसली कुछ चीजों के लिए आपको बाहरी सहायता की आवश्यकता है, वो ठीक है, बट 70-80% काम तो ऐसे ही हो जाता है ना. तो मतलब उसको एक्सक्यूज के रूप में ना लिया जाए तो.
Not only diabetes and blood pressure, the heart disease
Yes.
and the cancer is something.
Yeah. Well, what is the question?
Heart disease and cancer.
Why is the heart disease and cancer risk in everywhere in the world? In India, it is increasing. Number one, Indians are considered to have a high risk for heart disease and diabetes. One Dr. Tandon said that we come with a certain genetic predisposition, but that's not a major factor. It's like अगर हमारे पास एक बंदूक है, वो loaded है, to make it harmful क्या करना है, वो trigger करना है. You have to pull the trigger. So we may be like loaded guns, but the trigger comes from these lifestyle factors, right? So that second hit, which is required to make you much higher risk, comes from this. So the biggest risk is smoking, especially BD smoking. Actually, cigarette smoking has come down in India because of the taxation policies. But BD smoking still is very high, so we have to educate people about BD smoking. Second is oral cancer is high because of the chewing of tobacco. People chew tobacco, they keep, even without tobacco, they keep that thing in their mouth, so it causes what is called a submucosal fibrosis, which leads to cancer. The colon cancer, breast cancer, and other cancer, liver cancer are all related to high fat intake and high carb intake. So, and low fiber intake. So you have to increase the fiber. It's a common theme across the board. So the three things which can decrease 4 diseases are avoidance of smoking, a healthy balanced diet, and high physical activity. And avoidance of alcohol. If you do these 4 things, you can avoid 50% of the NCDs. You can postpone it. Ultimately, somebody might here ask me, "Bhai, kabhi to marna hai. अब किसी को तो आएगा." Our thing is, it should not happen before 70 years, which is our life expectancy. It should happen after 70 years, and even if it happens, we should manage. People should live healthy, happy till 80 years. So for that, lifestyle is important. And second thing is the simple drugs. Once you develop the disease, simple drugs are there. Very, very simple. 50 पैसे की drug है, that will take care of it. And regularly करना है. So that education should go to people. अगर आपको बीमारी है, डॉक्टर जो प्रिस्क्राइब किया हुआ है, उसको ले लीजिए. One.
And just let me just add, I mean, it should be put on record that, you know, the government has taken cognizance, the government is doing all of this, right? But it's also the individual who has to step forward and take up what has been offered by the government. I mean, we just went to a primary health center in Gumti, and all the basic medication